We are going to talk about a remedy, which is a Friday night remedy, which is a Saturday night remedy, a remedy which enjoys going out, a remedy which enjoys doing anything and everything is forbidden. If you say no, the remedy says yes. If the father says no, the remedy says yes. Why it is a Friday night remedy? It is a great desire to go out.
Medorrhinum is a remedy which is predominantly indicated for the people who are very comfortable at night. They are happy, exhilarated, and excited as the evening sets in. It is a very important remedy for people who are very passionate and loving. They have a strong desire for love and affection. It is indicated in behavioral problems of children. Children who are rude and aggressive, who throw temper tantrums.
Who fight with other children, especially during the day, and who can kick and strike their parents or relatives, can be Medorrhinum.
At night, these children become very playful, comfortable, and affectionate. Such a behavior can be expressed by the phrase, cross by day, merry by night. It is one of the important remedies where there is a history of gonorrhea in parents or patient in the past. The other causative factor is anticipation. Anticipating the sickness brings on the trouble, and also thinking of the complaints. +3. Right from childhood, they have
Understand this, that they are very, very passionate people and their clairvoyance is very high. And because the clairvoyance is very, very high, they are not able to control their feelings and emotions. Okay. And that is why they see the event coming up and they cannot control it. They can read it. Okay. It's very, very important.
the capacity to perceive intuitive feelings, and this intuition usually comes true. On many occasions, they can predict accidents, natural calamities, or results of exams. And in reality, it actually works out to be true.
The other extreme of love, that is hate, is a much stronger feeling in Medorrhinum. A child...
Are you able to understand this? The clairvoyance is so high that they are able to see the result. They are able to predict the calamities. And these calamities are very, very easily available to them. They can even know what are the marks they are going to get in the exam. So, like Netram, they have extremes of emotions of love and emotions of hate. And the hate emotions are much stronger than the love emotions at times. Keynote prescriptions. This is what happened in this case. I was on a hospital round, and this case belonged to somebody else, some other physician. And I saw the patient, and I said, the remedy is very clear. The treating physician was surprised. He said, how can you decide the medicine in such a short time? You have hardly seen the patient. You have not even talked to the patient. You have not taken the symptoms. You have not taken the case. But still, how you are so confident that the medicine will work? I said, it will work. Okay. The patient was sitting down in Nietzsche's position. It was a winter. I remember it was February. And for him in the hospital, he had kept the full fan on. Okay. Full speed. And still he was feeling hot. And the patient was breathless, continuous cardiac asthma. If you have seen a patient of cardiac asthma, you'll be able to understand that they would feel breathless even at rest. And the difference between bronchial asthma and cardiac asthma is, in bronchial asthma, as soon as there is an remission or a quiescent phase, there is no breathing difficulty. But in cardiac asthma, the breathlessness continues all the time and they are not able to walk. So the patient was prescribed Medorrhinum 32 pills every 4 hourly. Now you'll wonder why 4 hourly? Because of the chronicity of the problem and the acuteness of the disease. The disease was not uh, responding to any other medicine. Medorrhinum 32 pills 4 hourly was given, and to my surprise and to the surprise of the treating physician, within 24 to 48 hours, the patient started passing lot of urine. See, only way we can throw out the toxin is from the breath, from the urine, or from the sweat. The patient immediately started passing lot of urine within very short time, and the patient started feeling better. He could sit down. He did not have to be in the Nietzsche's position, which is typical of Medorrhinum. Within a week, the patient started moving, no symptoms of breathlessness. In a month's time, he was absolutely normal and was able to go to work. Now, this is the kind of shift which can happen with the right medicine. With the right medicine, you become so healthy. So even the acute exacerbation of the diseases like cardiac asthma can be handled with right medicine. Selection of the potency is very important, but repetition is more important. You have to repeat the medicine in such a way so that you get the relief. In too high a potency, this would have produced severe aggravation and could have produced a lot of complications with the patients. But less potency with little frequent repetition gave the desired response.